What I tell people is that typically if somebody decides to have surgery, it takes a certain period of time to make sure that it's safe. So you always want to make sure that any type of medical conditions that somebody may not be aware of are thoroughly evaluated, so that if there's something that is, let's say somebody has an area of the heart that has poor blood supply where they would be at higher risk for undergoing anesthesia, that is detected before surgery so that that can be remedied and the risks of the procedure can be minimized. So that's part of the preoperative evaluation process, and that process is typically going to take 2 or 3 weeks in most cases, but it can be done a little more rapidly if you have a system in place where you have medical individuals who can evaluate the patient, and if the patient doesn't end up needing any specialized testing, sometimes it may be able to be done a little more rapidly. But generally you're going to figure it's going to be at least a few weeks, and I think in most cases, most people end up scheduling surgery 4 weeks, 6 weeks, 8 weeks in the future, and that gives them time to plan their life and that testing process to be done. Then most people would come in the day of surgery, and they would have surgery that morning or that afternoon, depending on what time they were scheduled, and then they would go to the recovery room and then back to the floor, and while they were in the hospital, they would receive physical therapy. And most people, in most places, will stay in the hospital for 2 or 3 days. There are places that will discharge people even same day if they're really, really healthy people, or day after, but most places would keep people 2 to 3 days in the hospital, and then at that point some people would go home and a therapist may come to their house, or they may go to a rehab facility where they would continue to recover. Typically, while the person is recovering, initially most people would use a walker for the first couple of weeks, and then they would move to a cane, and then usually by the end of 6 weeks they can get rid of their cane. I think it is shorter than a lot of people expect, and I think most people, when they ultimately make a decision to undergo joint replacement, most people will come back and say, I wish I'd done it sooner. But I base it, my feeling is that people should have that opinion. So in other words, if they didn't have that opinion, then they would be wondering whether or not they needed it at all in the first place. Right. So I think it's a good idea for people to wait till they're sure that they need that type of intervention. But most people, once they make a decision, will come back and say, I wish I had done it sooner.